Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, here in this video we can see important questions for exam. This will helpful for your upcoming future exam. And let's see the questions. First question, Monday fever is also known as, and options are option A anthracosis, option B silicosis, option C byzinosis, option D bagosis. So here correct answer for this question is option C. Byzinosis is also known as Monday fever. And remaining option anthracosis is there. This anthracosis is caused by coal dust infection, anthracosis, and silicosis means occurs due to silica dust, and bagosis occurs due to cane fiber dust. Here byzinosis means it occurs due to cotton dust. Okay, it is also known as Monday fever. Question number 2. EPI includes all the vaccines except. EPI means Expanded Program on Immunization. And options are option A DPT, option B polio, option C MMR, option D all of this. And the correct answer for this question is option C. MMR is the correct answer. So Expanded Program on Immunization was launched in the year 1974. Year is important, 1974. And it includes 6 vaccine preventable diseases, that is diphtheria, pertussis, tetanus, polio, measles and tuberculosis. In our question, EPI includes all the vaccines except is the question. So, MMR is except one. MMR means mumps, measles and rubella. But measles is included in our expanded program for immunization. But mumps and rubella is not included. So, answer is option C, MMR. Question number 3. Position for the patient with continuous RT feeding is. And options are option A supine, option B Fowler's, option C Trendelenburg, option D side-lying. And the correct answer for this question is option B Fowler's position is given for the patient with continuous arterials to feeding. And the next question, question number 4. In a patient with acute liver failure, the best prognostic indicator is. Options are option A serum bilirubin, option B serum albumin, option C alpha fetoprotein and option D factor V estimation. So question is a patient with acute liver failure, which is the best prognostic indicator among this option? That is our question. And the correct answer is option D factor V estimation is the correct answer. Here question is which is the best prognostic indicator, not diagnostic. Serum bilirubin, serum albumin, alpha fetoprotein and all some diagnostic measures, but factor V estimation is one of the prognostic indicator. Factor V means is a liable factor. Okay, this alpha fetoprotein is one of the tumor marker for hepatocellular carcinoma. Question number 5. Commonest side effects of cisplatin in a patient with esophageal carcinoma is. And the options are option A liver failure, option B thrombocytopenia, option C acute tubular necrosis and option D all of this. Our question is which is the common side effect of cisplatin in a patient with esophageal carcinoma? And the correct answer for this question is option C acute tubular necrosis. This cisplatin is an anti-neoplastic drug. Once the patient is taking this anti-neoplastic drug, most commonly nausea, vomiting, diarrhea will occur for the patient. That is the common side effect. But this cisplatin will cause a nephrotoxic effect. Okay, it will affect the kidney. So once the nephrotoxicity develops, that may lead to acute tubular necrosis. Okay, so option C is the correct answer. The next question. Question number 6. Most common late CNS complication in HIV is. And options are option A delirium, option B dementia, option C ataxia, and option D all of this. Most common late CNS complication in HIV is option B dementia is the correct answer. Dementia means loss of memory is the last late complication of HIV. Question number 7. Angiotensinogen, which is a plasma protein produced by. Options are option A kidney, option B liver, option C lungs, and option D intestine. And the correct answer for this question is option B. Liver is the correct answer. Angiotensinogen is a plasma protein and which is produced and released into the circulation by liver cells. Okay, option B is the correct answer. Question number 8. The hormone responsible for fight or flight response is named as. And options are option A corticosterone, option B aldosterone, option C adrenaline, and option D cortisol. This is an easy and important question. And the correct answer for this question is option C. Adrenaline is the correct answer. Adrenaline, which is responsible for fearful situation. So it is known as fight or flight response is adrenaline. Option C. Question number 9. Normal operation theatre temperature is. And options are option A 15 to 18 degrees Celsius, option B 18 to 21 degrees Celsius, and option C 20 to 25 degrees Celsius, and option D 20 to 28 degrees Celsius. And the correct answer for this question is option B 18 to 21 degrees Celsius is the normal operation theatre temperature. This is also an important previous year question. Okay. Question number 10. Which hormone is known as 5-hydroxytryptamine? And the options are option A histamine, option B serotonin, option C secretin, and option D thymosin. And the correct answer for this question is option B. Serotonin is known as 5-hydroxytryptamine. Okay, so study well, do hard work. How much we are taking effort, that much the exam will be easy.